joined by a few of my colleagues to discuss one of our exciting new features and updates. We'd like to discuss something we call PMP Now. It might be a little bit of abstract idea for some of you, but that's what we're here for, to help educate and share information, as well as discuss a new feature that I take very much to heart. It's called My PMP Pharmacy, and then go over some of our education offerings and some of the exciting changes on how we'll be able to share information with users and providers across the state. So without further ado, I will ask for Jen Erickson or Jacqueline DiNardo, who is our PMP Now team. They will be sharing slides and walking you through the PMP Now feature.
Hello, is everybody able to hear me?
Yes.
Okay, good. 1 second, I am pulling it up. Let me know when you're able to see my slides.
We see them now.
Okay, perfect. All right, so I am Jackie DiNardo. I'm the PMP Now coordinator, and Jen Erickson is also on the call, and she is the PMP Now director, as Eric said. So we will be going over some of our items with the PMP Now. And for those who don't know, the PMP Now is the direct integration into the electronic record. So instead of providers or dispensers having to log directly into the website, they can access the PMP information from within their EHR or pharmacy management system. So the PMP Now has many different wins over the last few years. And so we've highlighted some of those on this slide. So as of yesterday, we have a total of 14,447 connection points. And those are individual connection points will be discussed later on. And then we have 1,571 healthcare entities. So that is the organizational level, where the 14,000 is the location level. We have connections within over 100 EHRs and pharmacy management systems. Delegates do have access through this connection if it's developed that way within the EHR or pharmacy management system. Since August of last year, we've had over 78,000 distinct users access the system through the PMP Now connections. There is facility level access available if it is required by state. So what that means is it doesn't have to be a specific provider. There is access through just a facility level. And then on certain connection points, we do have 24/7, 365-day chat support in the interface. And that's with our more advanced UI, which you'll see a picture of later on in the slides. So this slide is showing the information to kind of give a visualization of the growth of the program itself since 2016 till 2022. So as you can tell, we've grown significantly in healthcare connected entities. And then also our query totals have grown significantly. And now we are consistently hitting around 10 million queries per month. And hopefully we'll hit that 11 million query soon. I think we're pretty close to it. And this information that's on here is available on the website as well underneath the monthly statistics tab. So you can see the queries per month, and also the connected healthcare entity number. That information is available online. And then number 2 is just a graph to visualize the data that's in the number 1 box. Oh, hit the wrong button, I'm sorry. So this is healthcare entities and connections. So this is kind of to explain that 14,000 number versus that 1,500 number. So an entity such as Advocate Aurora Health, who uses one instance of Epic for all of their locations. They have, 26 locations and many sites of care and thousands of physicians. They would be counted as one organization, but they have many locations. So they would have, all of those locations would be counted in that 14,000 number, where the 1,500, they would be only counted as one. And then same thing, like we'll have JCH Healthcare. They say they have 3 different connection points, CPSI, T Systems, and Greenway. It would be one unique healthcare organization with 3 different connections. And then a small physician practice would be 1 and 1. And the reason why we count this way is because it's hard to really show the to keep, what's the word I'm looking for? It's hard to show a large entity and compare it to a small provider office. So doing it at that organizational level is how we create a level playing field for all of those. And the locations then are the overall further connection points. And if this doesn't make sense, we'll have some time for questions if there's any questions on that. And then this slide is to show all the different types of organizations and healthcare locations that we are connected in currently. So we do have everything from health departments, long-term care, urgent care, FQHCs, pharmacies, hospice, opioid treatment centers, dentist office, optometry, things like that. So an array of different healthcare organizations and entities that we are able to connect with at this point. And then the next slide is going to be the connection views that we have for the interfaces. So this view is what we call the flat file. It's there's some vendors that still do have this, depending on where you work. This might be what you see. It's more of just it's just the prescription information that's collected from the ILPMP. There's no matching. It's only prescriptions, things like that. It's more basic view. And then we also have the interactive connection view, which is our preferred method for connecting locations now. And this is based on what the EHR does. So we're going to be hopefully moving a lot more places if they are still on that NCPDP to this connection, but it is up to the vendor to decide which way they create this. But this does give you the ability for multiple states, the additional data sets that are included on the website, such as medical cannabis and naloxone administration. It also has the ability of for patient matching, which you can see on the left-hand side. It has drug classifications, and it also has a referral button to the helpline. So very interactive, a lot more information for the providers to use within this system. And so this slide is just kind of to show what we've done in the past and what we're going to do beyond for our EHRs. And then the next one will be for pharmacies. So 2016 to 18, there was a heavy focus on hospital systems, on large electronic health records, like very widely known ones, and then identifying those additional locations that would have to be connected and reaching out to the OTPs. 2019 to 2020, providers that were requesting access, trying to get them connected, reaching out to dental offices and trying to get that started, building back-end tools and for tracking and reporting. So creating the system that we actually use today to integrate, to keep track of who's been integrated, working with Medicare and Medicaid providers, and then the development of our PMP Now plugin or adapter that is a tool for providers that have a small office or maybe a pharmacy that has a homegrown system that maybe their EHR isn't connected, or it's a significant financial impact by connecting to the EHR. This is just another way that a provider could or dispenser could get access to the system without having to log into the website. But it does take a little bit of a different approach on development. So we do that if that's requested by the locations. And then in 2021 and 2022, we really focused on long-term care facilities and small provider offices. And then also certified health IT modules became able to connect. And so that opened up a lot of connection points. And then 2023 and beyond. So continue our reaching out to the opioid treatment programs, getting those incorporated into the PMP now, revisiting the Medicare and Medicaid provider list, completing new EHRs and certified health IT module integrations as always, and then collaborating with our sister agencies so that we can ensure all locations are connected. And then with pharmacy focus, 2018, 2019 were those initial discussions with those big chain pharmacies and also with some small vendors. 2018, we did have a few go live. So BestRx, Compulsive, Liberty, QS1, and FastRx were integrated and went live. In 2020 and 2021, Walmart developed and successfully tested. And then in this year, they finally did their rollout and went completely live. And then we had a few other big players that were able to get connected within that time frame as well. So CVS and then Walgreens being two of the big ones, and then PrameRx. In 2022, we were working with McKesson, which was great because they also have a big clientele. So that was really helpful to get that started and get that relationship going. And then 2023 and beyond, like I said, Walmart went live this year, TDS went live, and then also we're continuing that pharmacy outreach. So with this, we've been trending some legislative changes. As we know, when things change, potentially our process changes. So it moved from any point of the workflow to some of them are now within e-prescribing modules. Some delegates are not able to access through e-prescription software. There could be an increased cost to users. So and this is regards to the rule change of certified health IT modules. So there's some things that that happened when this was a change. I don't know, Jen, if you have anything additional you want to say on this slide for the group.
Just that we're monitoring some upcoming legislative changes that once signed by the governor will lead to some additional changes for the PMP Now interfaces. Just that we continue to monitor and continue to move it forward.
Okay. So this goes with that previous slide. So this is what we were trending after the change that happened for the certified health IT modules. Some of the hospitals that switched from the original process to this new process, we saw significant decreases in their query volumes. So this is one of the things that we were tracking and trending with that, which is why we noticed that there was such an impact with that change to the e-prescribe. And then that's the end. So if anybody has any questions, please let us know. I don't know if you want to open it up, Eric, to questions.
Yeah, I'm sorry, I forgot to mention that. I would like to, maybe a little bit different than a lot of other presentations, after each one of these, I'd like to open up for questions. So if anybody has them, feel free.
Jacqueline, this is Chris Herndon. I appreciate your overview. Thank you very much. I do have a couple quick questions that I'm not sure how to interpret. When the Public Act, I guess it was 0564, I think it was, went into effect in terms of every prescriber registering for the PMP. And then I think there was a second part that said something about an initial C2 script, either the PMP has to be queried or an attempt has to be made. Does my PMP have the ability to track those things at that granular of a level? Or, I mean, is that something that each individual prescriber is going to need to make sure that they're following up on their own?
So Jen, correct me if I'm wrong, but most of the connections within the EHRs, they do build in there something that either shows that they queried or they can check a box that says that they queried the PMP. or attempted to query the PMP. Jen, is that correct? I
All of
believe.
them do. The other component is that the statute actually says the provider the document in the electronic medical record that they did do that. So we do not have
Jen, you're real choppy.
we do not have a specifically defined what they have to do, but the statute does say that the provider or the prescriber is responsible for documenting in the electronic medical record system.
Thank you.
Are there any other questions? And if not, if you don't think of anything right now, you can always reach out to us at dhs.pmp@illinois.gov for more information if you do have any additional questions.
Thank you, Jackie. I will be sharing a screen just a moment here. And we can start discussing PMP now. Or I'm sorry, my PMP. That goes hand in hand with my presentation. Okay, can you see full screen right now?
Yes, sir.
Okay, this is the one that's very near and dear to my heart. I was working on developing this over the last, I'd say about 6 months, kind of heavily here and there, our My PMP pharmacy. So first and foremost, it just kind of sounds like one more thing that the state has that has RX or PMP in the name. Well, kind of, but it's more than that. So what is it? Essentially a way for pharmacies to look at the most recent controlled substances and non-controlled drugs of interest in their pharmacy, looking at 1,000 scripts over the last up to 2 years of history. And who is it for? It's for a pharmacist in charge to look at their store specifically based on DEA number for those script histories. They can also designate up to 3 pharmacists that work in the store to be able to view the data as well. And why do we need it? Well, right now, you can look at a patient history on the PMP website for up to a year. You can, as a prescriber, go in and look at your prescribing history up to the past 2 years. And pharmacists don't have that chance. How do we access it? Through the PMP website, ILPMP.org. That's where we live and that's where we like to improve things. And going to your login screen, you'll see something at the bottom labeled right now. It says top prescriptions. However, we're not dead set on that. It's a working title as we help develop this program. And when will it be available so you can see if it's top prescriptions or not? Hopefully by September, we will have some beta testing underway using a few pharmacies and their DAs working with the PICs to identify any issues with the rollout of the information, what would need to be seen, etc. So just a quick walkthrough and pictures here. You log in, and then at the bottom of your homepage, you'll see something like top prescriptions. Now, this is my screen. When I log in, I have a few more tiles than most of the people that on this call. Once you select top prescriptions, you can also go in to designate your pharmacist that might have access. And here, this is a fake pharmacist with a fake license number at a fake pharmacy. So rest assured, this is all HIPAA compliant information. And you can designate up to 3. Once you designate 3, you will lose this option to submit an additional license number. And when you check out your scripts, you will see a screen something like this. As you can tell, this is still in testing and we're still editing the page, it won't say title for selected field. It will probably say something like your pharmacy name or information about the history of these prescriptions. Right now, this is how we have it set up. However, we are going to add, rather than just serial number, we may be adding a prescription number in there or some assorted other information as identifiers. Excuse me one moment. So let me hold on the questions and comments. I'm going to stop sharing for just a moment and give you a brief walkthrough on the actual website, because it is live on our test server. So I can show you guys how it looks. Okay, are you seeing 3 tabs right now?
Yes.
Okay, perfect. I have a lot of windows open. Sorry about this. Okay, so I've already logged in to try and make it a little bit easier. Rather than searching a patient up here, you'll just scroll down, make sure you check for these virtual lunch and learn series, and then select, it'll say top prescriptions. For me, it might say something a little bit different. And you will be able to go in and find your designate pharmacist page. So in here, I can enter another fake license number and add Katarzyna. Once I add a third one, you'll see this goes away. And the same process for removing right here. Everything else it's very similar to using a designee to have access to search patient records in our PMP website. And we are treating it similar to how a prescriber or a dispenser would identify a designee for access. Every 6 months, you verify, or within every 6 months, you verify the search history for that designee and that they are still working with you and a designee that should have access. There will be a similar process for pharmacists. Looking at our data, our dispensing data, right now you can see the pharmacist in charge, John Doe. It's a CVS and McHenry, and here is our fake DEA number. So there's a little bit of information displayed at the top that may be of interest. It kind of summarizes what may be a little bit more difficult to see in dispensing software at an individual pharmacy. Instead of displaying controls and these drugs of interest, such as naloxone or gabapentinoids, you can see, you might see just one pharmacist or one patient's information. We put it all in one spot. That's another benefit of this tool. So in here, you'll be able to check for multiple provider episodes, 90 MMEs per day, and these may also change as time goes on and once we get some beta testing underway. And then you'll be able to search or select one of your patients. I believe some of them do not work as it's a test server. We'll see if I can get one to pull up. Last try and we'll move on. Okay, so unfortunately there are no patients that are also on the test server that would show what you would see. But if you've ever searched for a patient on the PMP, then you would know how the display looks. It pulls up that patient's history and you can identify prescribers that are related to that dispensation, as well as other information that would be in a patient's history. So it's kind of a one-stop shop. Now, after showing you a few pages here and discussing the program, we would love to have as many questions as possible on this, as we are still in development. I will also note that we receive a pick list from IDFPR, so we have a record of who is a pharmacist in charge in order to properly assign control over the MyPMP pharmacy program.
Eric, that's super cool. When is your anticipated rollout, did you say?
We are, I think at best option right now, we may be able to roll out as early as towards the end of September. However, I think the more realistic goal is that we will be doing some real world testing or beta testing with some select pharmacies across the state to see what issues we actually encounter in the real world. So I would think by the end of the calendar year, we might be able to roll out the final product. But if there are any pharmacies that are interested in participating in our real world testing, we're absolutely happy to have more input on this than not. Any other questions?
Nothing in the chat.
All right. Okay. I will move on. And last, I want to discuss some educational offerings and information sharing that we're very excited about. One is for continuing education. PMP currently has two partnerships, one with the UIC Drug Information Group. They have one live CME program for the benefits of a designee on their website. I'm sorry, I forgot to link websites. I will throw them in the chat before everybody leaves. And then we have another one that will be live in July on buprenorphine and the removal of the X waiver information. And also we have a partnership with the School of Pharmacy, SIUE, for a 3-hour program, which is 6 30-minute CME and CPE modules that should be live. Chris, you can correct me if I'm wrong. I thought you said the end of July, but I didn't want to put that in there. These will all apply, these 3 hours will apply towards renewal of a controlled substance license. And our go live should be within the next quarter.
Yes, end of July is our target date. And we're really excited to share these with the state, both pharmacists and prescribers. I think they're going to be really fun and easy to navigate. So stay tuned.
Yes, absolutely. And they will be, right now, they're going to be hosted on the School of Medicine's website and on the School of Pharmacy's website. However, Chris is working on creating one link for both. So you can go to one page and select whether you're taking the CME course or the CPE course. Another educational outreach program that we're proud of is academic detailing. And we've actually been modifying this recently for one-on-one visits with prescribers. And this is a partnership with UIC's Pharmacy Systems Outcomes and Policy Group, where we identify high-risk prescribers through the PMP's peer review process, which looks at right now the previous 6 months co-prescribing of opioids and benzos. We select a threshold, we'll identify a top number of prescribers, and then the peer review committee, made up of 10 multidisciplinary members, will take a look at the prescribing history and we gather some information through survey questions to the prescribers. And we recommend academic detailing from UIC will go out and conduct at least one visit with a majority of them. The attempt is for 2 visits focusing on the new CDC guidelines, of course, coming out recently. That's a hot topic still. And then naloxone co-prescribing with opioids. Additionally, it's not a direct partnership, but UIC's Illinois Advanced Group, they specialize in multiple disease states, I believe 8, and focus on Medicare and Medicaid prescribers primarily, but they're open to contact directly from any provider, and they will reach out and conduct an academic detailing visit, anything from diabetes to renal failure. There's a few others. I believe they even have one on smoking cessation. And their website, illinoisadvance.com, I've linked below. Another really exciting thing that it's kind of an overarching update, and it's going to look much better when we are complete, once this all goes into effect. So in our continuing education contract with the School of Pharmacy at SIUE, these lunch and learn activities are part of that, yay. As well as developing 10 short animated videos covering some clinical information. So kind of snacks, 2 to 3 minute little snack videos. They're fun and animated. You can watch them on our YouTube channel. You can subscribe below. Well, you can't click that to subscribe, but you can visit our YouTube channel and subscribe. These will go up as well. I believe you mentioned, well, in the next quarter, we'll have all 10 of these videos up. And then we're working with a marketing vendor to develop 10 short animated videos for user information, such as logging in and registering, assigning a designee or managing them. Actually, PMP Now is covered in that, as it'll be covered. And these will be, again, short 2 to 3 minute snippets of information, not too taxing to watch, and just kind of much better than reading a policy manual or something like that. They're also assisting with rebranding and overhauling some of the PMP website features. If anybody's been there recently or in the last 7 years, it's a field of corn in the background, and it's a little bit clunky to use, but we want our users to go there for an educational resource and for general information. So you can go to our educational resources page now. There's a list of items on there. However, it would be a little better if it was maybe some drop-down menus or something. So we're working with a marketing team to kind of give it a little bit more visual pop, a little bit better usability. And we're very excited about that as well. You can see there's a link down at the bottom for our educational resources. And those are really the main exciting updates that I wanted to discuss. And I will open up now, I think, for any other questions over any of the topics, or Chris, if you want to touch on the animated videos as well, feel free to do so. You can always reach out to us at dhs.pmp@illinois.gov for any questions if you don't want to ask now.
Thanks, Eric. The first thing I wanted to mention is we'll be rolling out the animated videos as they're produced and approved by the ILPMP folks. So the first one should probably be rolling out within the next week, and then they'll come online as they're developed shortly thereafter, with all of them being up by the end of August. I'm getting some questions in the chat that I wanted to make sure we're covering correctly, or that I'm answering correctly. So if somebody is practicing out of state, but they have an active Illinois license as a prescriber of controlled substances, my interpretation of the law is that they must go in and register for the ILPMP. Is that everybody else's understanding of that law?
That one actually, I know we've got Sarah Pointer on here. She may be able to speak to that better.
Sorry, I was muted. Yes, that would be the interpretation. If you have a active Illinois controlled substance license, you do have to register with the ILPMP on the website.
Right, thank you. Even if you're registered in your home state's PMP, that's not like reciprocal. We still need you to go on and register as a provider on the Illinois PMP as well.
Correct.
I guess why we have so many representatives of the PMP on the webinar today, and thank you all so much for joining. I guess if I came up with a couple particular questions, for the record, could we maybe figure out good point people to, or the best way to contact the PMP? For instance, if say I'm trying to sign up, but I'm having difficulties, is the generic email and phone number that's on the website, is that the best number for people to call?
Yes.
And should that be used for every issue, and then it gets internally triaged to the appropriate people, or are there specific contact folks that are the best people to contact for different particular issues?
We typically direct everyone to the general mailbox for triage.
Okay. I'm out of questions now.
Okay, well, open up to the rest of the group. Is there any other question for us at the PMP or for Chris?
I would just say that for those folks that might be listening to this later as an enduring material, just to reiterate that if you have a controlled substance license, you are practicing in Illinois, and you have the integrated PMP, EHR PMP functionality, you still need to go in and individually register under your license and DEA number for a PMP registration. Even if you are able to pull it up in your medical record at one click, that does not, to my interpretation, satisfy the current law.
Correct. EHRs do not satisfy the law. If you have a controlled substance license, you must be registered. If it's an active controlled substance license, with very few exceptions for primarily veterinarians. But EHRs do not count, as well as if you don't log in once per year, your account will deactivate, essentially.
Okay. Well,
To
Dr. Huff, thank you
clarify,
very much.
even if their account is deactivated, the law just states that you have to register with the ILPMP. It does not state that you need to maintain an active account, just for clarification purposes.
Thank you.
So as long as you have registered, you would be considered in compliance.
Are you all still giving away a free toaster to everybody that registers? Is that still a thing?
We are working on that. We'll
I remember when I was a kid, my mom going in and opening a bank account because they were giving away toasters. So maybe a blast from the past. All right. Well, thank you everyone for joining. It sounds to me like the questions might be quieting down a little bit. And so in the interest of everyone's lunch hour, you have, it looks like 19 minutes to go scarf a sandwich and get a drink before clinic starts back up or your 1 o'clock meeting. But thank you very much. Please stay tuned to our 4th Lunch and Learn webinar that we'll be sending out information on here shortly. And thank you again for our special guest, Eric Huff, and the rest of his colleagues with the Illinois Prescription Monitoring Program who are kind enough to join us today. Thank you very much.
Thank you.